Hello everybody. Today our topic is heart failure. Heart failure is defined as a complex clinical syndrome in which the heart is incapable of maintaining a cardiac output adequate to accommodate the metabolic requirements and the venous return. Let's talk about the incidence and prevalence of heart failure. Heart failure is estimated to affect more than 22 million people worldwide, with an estimated of 2 million new cases diagnosed each year. In the United States, it is estimated that 5 million people have heart failure, with 10 out of every 1,000 over the age of 65 being affected. It is the only major cardiovascular disorder that is increasing in incidence and prevalence. When speaking about the prevalence of heart failure by age and gender, this chart shows that males have a higher incidence of developing heart failure compared to females until they reach the age of 65. At that time, at the age of 65, females essentially equal males in the incidence of developing heart failure. The New York Heart Association Functional Classification, the NYHA classification, is made up of 4 classes. The first class, which is no symptoms with ordinary activity. The second class, which is slight limitation of physical activity. Comfortable at rest but ordinary physical activity results in fatigue, palpitations, dyspnea or angina. Whereas class 3, there is a marked limitation of physical activity, comfortable at rest, but less than ordinary physical activity, which results in fatigue, palpitations, dyspnea or anginal pain. Finally, the class 4, the patient is unable to carry out any physical activity without discomfort. Symptoms of cardiac insufficiency may be present even at rest. So, in summary, class 1, no symptoms with ordinary activity, class 2, a slight limitation, class 3, a marked limitation, and class 4, at rest. After completing a thorough history and physical exam, physicians will commonly use the NYHA functional classification to help describe the degree of physical disability a patient has. The NYHA class is also commonly used to determine entry criteria for patients participating in clinical research trials. What about the heart failure classification based on the evolution and disease progression? There are 4 stages of heart failure. Stage A, the patient is at high risk for developing heart failure with no structural disorder of the heart. Stage B, the patient with structural disorder without symptoms of heart failure. Stage C, the patient with past or current symptoms of heart failure associated with underlying structural heart disease. Whereas stage D, the patient with end-stage disease who requires specialized treatment strategies. When speaking about the severity of heart failure, interestingly, most patients who suffer from sudden cardiac death, which are 64%, are the patients who are minimally symptomatic with class 2 NYHA heart classification. The sickest, the most symptomatic patients, who are the class 4, the NYHA, experience heart failure deaths 56% from pump failure rather than sudden cardiac death, which are 33%. It is important to remember that although it can be said that a heart failure patient in NYHA class 2 may have a higher risk of sudden cardiac death, the relative annual risk of dying is less than other NYHA classes. What about the etiologies of heart failure? The etiologies of heart failure are based on that there is a loss of critical quantity of functioning myocardial cells after injury to the heart due to what? Like ischemic heart disease, 2 hypertension, 3 idiopathic cardiomyopathy, 4 infections such as viral myocarditis, Chagas disease, 5 toxins, example alcohol or cytotoxic drugs, 6 valvular diseases, 7 prolonged arrhythmias. These I mentioned now are in order from the most to least common causes for heart failure.